Finally tonight, we have heard a lot lately about third doses of the Pfizer and Moderna vaccines. But this week, the CDC quietly started recommending a fourth mRNA shot for people who are moderately and severely immunocompromised. So this is for people with medical conditions that make it difficult to build or retain immunity.
They should get a fourth dose of an mRNA vaccine 6 months after they got their third. Most people doing that pretty recently, so this is going to be a little ways off. A doctor who is clinical director of a COVID-19 task force explains why.
So 3 doses for the immunocompromised is equal to 2 doses for the rest of us. So the booster then for the immunocompromised would actually be their 4th dose.
According to the agency, people over 18 who are moderately to severely immunocompromised may get a 4th dose, and that includes people who are HIV positive or battling AIDS, people battling cancer, and transplant patients, and those with inherited diseases that affect the immune system, and they would get it 6 months after their 3rd dose.
So sticking with vaccine shots, we've gotten plenty of booster questions sent to our verified team, and really chief among them, people have been asking which booster is best.
Yeah, and there's a viral graphic going around online claiming to answer that question, but is it legit? Evan Kozlov has the verified answer to that.
The CDC is now recommending boosters for millions of people, prompting one big question: which one should I get? Enter the internet, trying to solve that question. A graphic has been circulating on social media ranking the 3 boosters for each of the vaccines. So let's verify, is this graphic based on real data? And what does it show about which boosters we should get? Our sources are the CDC, a study from the National Institute of Health, and these 2 medical experts. First, we could confirm that the data is real. It's based on this study from the NIH, which looked at 458 people, split into 9 groups. Each group had some combination of the 3 vaccines and 3 boosters. And the numbers referenced in that tweet show what's called the geometric mean fold rise.
Geometric fold rise refers to the level of antibodies that are measured after you get a vaccine. So anytime you boost, you're going to get a rise in antibody. They're going to rise 2-fold, 3-fold, whatever it might be.
And according to this data, it's clear there was a much bigger response to mRNA boosters. Our experts say that's especially the case for those who got the Johnson & Johnson vaccine. In that study, their antibodies jumped 4.6-fold after getting a J&J booster, but they jumped 32.8-fold for a Pfizer booster and 56.1-fold for a Moderna booster.
So clearly, J&J followed by one of the mRNA vaccines gives you a higher antibody level than if it were followed by J&J itself.
As for those who received an mRNA vaccine, meaning Moderna or Pfizer, our experts say that so far the data shows sticking with an mRNA booster is the way to go. Now we should note this is preliminary data, and the study itself points out that there are some limitations, including a small sample size. Also, Dr. Adalja points out that antibodies are just one way to measure immunity. So we can verify that yes, this graphic is based off of real numbers from the NIH, and so far it shows that an mRNA booster will create the most antibodies, especially if your original shot was Johnson & Johnson. With your Verify, I'm Evan Kozlov.
It was real, Kate.
Can you believe it? It's like a first, I think. That is it for today's Town Hall. If you have a question, send us a text to the number right there, 716-849-2220.